Hi guys, I am Dr. Monisha. Welcome to One Question at a Time series. Let's move on to the question. The cranial part of axillary nerve supplies all the palatal muscles except, okay, is it palatoglossus, palatopharyngeus, tensor palatini, or tensor tympani? They are asking about the cranial part of accessory nerve. So let us have an idea about the palatal muscles first. So we have a pair of tensor tympani, a pair of levator palati. Okay, we have a pair of tensor palati. We have a pair of levator palati. We have a pair of palatoglossus. We have a pair of palatopharyngeus, and we have a pair of musculus uvulae, all getting inserted into the palatine aponeurosis. So, a pair of tensor palati, a pair of levator palati, a pair of palatoglossus, a pair of palatopharyngeus, a pair of musculus uvulae. Okay, these are the 5 palatal muscles. Let us see about their nerve supply. So, all of these muscles are supplied by the cranial part of accessory nerve. Okay, the cranial part of accessory nerve except for the tensor palati. Except for the tensor palati, which we will see later. But all the muscles are supplied by the cranial root of accessory nerve, in other words the 11th nerve. When we are talking about the cranial root, the accessory nerve also has a spinal root, that we must know. Okay, so let us have a brief discussion about the cranial root and the spinal root. Okay, the cranial root originates from the nucleus ambiguous of the medulla and it comes out. Okay, the spinal root originates from the spinal nucleus from the first 5 spinal segments of the cervical part of spinal cord, and it comes out of the foramen magnum. Here you can see the foramen magnum. So it comes out of the foramen magnum and it travels together with the cranial root. Okay, the spinal root comes out of the foramen magnum and travels together with the cranial root with some amount of understanding. What happens then is both of them get united by the time they reach the middle part of the jugular foramen. You can see in the middle part of the jugular foramen we have the 9th, 10th and the 11th cranial nerve traveling. Here the cranial and the spinal roots of the 11th nerve are united. What happens when it comes out of the jugular foramen? Again there is a misunderstanding and the cranial root of the accessory nerve separates, okay, and joins with the inferior ganglion of the vagus nerve. You can see the vagus nerve also coming out of the jugular foramen. Okay, it has a superior ganglion and an inferior ganglion. The cranial root of accessory nerve, as you can see in this picture, see, it communicates with the inferior ganglion of the vagus nerve, and the further nerve distribution is through the pharyngeal branch of the vagus with regarding to the palatal muscles. So, when they ask about the nerve supply of the palatal muscles, undoubtedly it is the cranial root of accessory nerve. But when you have to be more specific, you can say that as cranial root of accessory nerve via the vagus nerve. That will be more specific. Okay, the cranial root of accessory nerve via the vagus nerve will be more specific. So what about the remaining muscle, that is the tensor palati? See, for that you have to see about the mandibular nerve comes out of the foramen ovale. Okay, so from the root you have 2 branches. One is a nerve to the medial pterygoid and the other one is a nervus spinosus back into the skull to supply the meninges. So here we have the nerve to medial pterygoid, which is carrying the otic ganglion, and it is seen supplying 3 muscles, namely medial pterygoid itself, tensa palati and tensa tympani. Why it is supplying the three muscles? Okay, because this tensa tympani and tensa palati also are derivatives of the first pharyngeal arch. Okay, the tensa tympani and tensa palati also are derivatives of the first pharyngeal arch, and that is why they are supplied by the nerve of the first arch, namely the mandibular nerve, okay, and by a branch of mandibular nerve, that is a nerve to medial pterygoid. So why tensa tympani alone? See, out of all muscles, why this tensa palati alone is supplied by this mandibular nerve? That is a branch of mandibular nerve or nerve to medial pterygoid. Tell me, because you can see this animal, these are modern echidnas. So what happens is, we all know that all mammals suckle. Okay, all mammals have the capability of suckling from their mother. What happened to this modern echidnas is, they are not capable of suckling. But when researched by the paleontologist, and when compared with the fossils of their ancestors, what happened is they found out one muscle that is very important for suckling, that is your tensa palati, that is very crucial for sucking, is missing in the modern echidnas. What they say is, the tongue along with the tensa palati of the soft palate that is seen to extend from the mandible forms a tight compartment, creating a negative pressure so that they can effectively suckle. Okay, so it is seen in the animals, the tensa palati is seen to originate from the mandible, and that is why out of all palatal muscles, tensa palati is supplied by the nerve of the first pharyngeal arch, that is mandibular nerve, via the nerve to medial pterygoid. Okay, so altogether, what is the function of soft palate? You all know this portion is your soft palate. So what happens is, it shuts off the nasopharynx from the oropharynx. That is its most important function. It shuts off the nasopharynx from the oropharynx. See here in this picture, you can see it is shutting off the nasopharynx entirely so that the food is swallowed peacefully. And here it is seen shutting off the oropharynx completely so that we can breathe properly without aspiration. Okay, so it shuts off the nasopharynx from the oropharynx, facilitating deglutition and respiration. That is the function of soft palate. But what about infants, where suckling and respiration happen simultaneously? What happens is, as we all know, you take a tube, okay? Okay? And this is the opening of the tube. The tube is divided incompletely by a partition. Okay, the tube is divided incompletely by a partition, and the anterior part of the tube is larynx and the posterior part of the tube is pharynx. Okay, this is a thing. Okay, you have a tube and the tube is incompletely divided in the middle, and the anterior part of the tube is larynx, which facilitates respiration and vocalization, and the posterior part of the tube is pharynx, which facilitates deglutition. So what happens is, in infants, the larynx is placed high up, okay, a little bit high. Okay, the larynx is placed high up So that, as you can see in this picture, the epiglottis is higher in position when compared to the soft palate. Okay, this blue colored epiglottis, okay, epiglottis cartilage is higher in position than the soft palate. So what happens if a tube is high above and it is separate? Okay, what happens is the milk goes around the tube. This is a tube. Okay, this is high above. Okay, and here is your soft palate. Okay, the tube is high above your soft palate. So what happens is the milk goes around the tube without interfering with the respiration. As you can see in this picture, the milk pathway, it goes on the sides of the tube without interfering with the respiration or having the risk of aspiration. So that is the important thing about infants, the highly placed larynx. Okay, so coming back to the question, the cranial part of axillary nerve supplies all the palatal muscles except it supplies palatoglossus, palatopharyngeus. But what about tensor tympani and tensor valli palatini? Both of them are supplied by the mandibular nerve because they both are derivatives of first pharyngeal arch, and specifically they are supplied by the nerve 2 medial pterygoid, which is a branch from the root of the mandibular nerve. Okay, so here the question has two answers, the tensor tympani and the tensor valli palatini. So coming back to the end of the session, it takes a great deal to take these classes virtually without any students, particularly for me who likes to get some response. Okay, so please like, share and subscribe, and please comment about the session, any remarks about the session, so that it will be a little bit lively for me without all being virtual. Thank you guys. Let us meet with another interesting question. Thank you.